Hello friends, this is Dr. Saurabh Patwardhan from Nanda Deepa Hospital, Sangli, India and Phaco Training Center. In this video, I'll be speaking about a case of soft cataract, and I'm using a microscope with stereo coaxial illumination which gives us a great red reflex. Pupil is very well dilated, so in such cases one has to be careful not to make a very large rhexis. So I advise you can use a CCC marker, but with experience you can judge the size of the rhexis as well. Now watch the CCC being made and watch how I am following the rule of center of triangle. So in my YouTube channel I have a video on rule of center of triangle, so do watch that to get a very good capsulorhexis with cystotome each time. Hydrodissection and hydrodelineation, both steps are absolutely essential for soft cataracts. And as you could see that I am making multiple layers of hydrodelineation and there are golden rings. Wonderful sight to watch. And once the hydrodissection and delineation has been done, I am going to go ahead with the phaco. The technique I am going to plan here is the carousel technique. I can see the hydrodelineation margin well. So what I am going to try is use the bevel down or sideways phaco tip and use the aspiration. So I rotated the nucleus a bit to loosen the nucleus from the bag, and now you can see my phaco tip is giving aspiration at the edge of this golden ring, so like this. So you can see that once I start giving vacuum at the edge, the nucleus just prolapses out. And for the epinucleus as well, you can see I am using the bevel down phaco tip and giving only vacuum. The most important thing here is to watch the posterior capsule. So if your intraocular pressure is being maintained, anterior chamber is well maintained, this is a very safe technique to use. Many times beginners are little bit cautious while using this bevel down technique because they are afraid that it will aspirate the posterior capsule. But if you have a good fluidics, good phaco settings, which means that the posterior capsule is going to stay down when you are doing this maneuver, it is absolutely safe and very quick. So for soft cataract and also for the removal of the epinucleus, this bevel down or sideways phaco tip works great because the occlusion is achieved much effectively and very quickly with this. While implanting a hydrophobic IOL, we have to make sure that we don't touch the optic unnecessarily. If at all we have to touch the optic, it has to be a blunt instrument. As you could see here that I held a lens at the optic haptic junction rather than on the optic and then loaded it in the cartridge. I generally use 2.8 millimeter incision because most of the IOLs that I use are more compatible with the 2.8 millimeter incision. Also the 2.8 millimeter phaco gives you much more inflow as compared to 2.2 because the irrigation will be little bit compromised. So if you are shifting from 2.8 to 2.2 millimeter phaco, you have to change your phaco settings. You cannot use the same vacuum or flow parameters with 2.2, and you may have to reduce them a bit to have a safer phaco and more stable anterior chamber. For me, I think anything less than 3 millimeter is a good incision to have, which has very little astigmatism induced. So clinically, I think any incision less than 3 millimeter behaves similarly. Watch the hydration of the incision, where I hydrated the outer part of the incision and not the inner part, which is very important, a common mistake. Do watch my video on incision closure. Lot of good tips are there in that video. I think every step has to be well done. You could see that I hydrated the anterior lamella here, so that the anterior chamber was well formed, and at the end I am injecting intracameral moxifloxacin. Here I generally dilute it 1:2 and then inject it. Thank you so much for watching, and for more videos do visit our website and also subscribe to my YouTube channel. You can submit your videos for review and publishing on the website. You can win Video of the Month award. Thank you so much.